Okay. Oh, which one? Okay. Oh, okay. Yeah, just when you get it in, just give us a call and we'll come check it. All right. All right. Bye-bye.
All right, we'll come back from recess. I understand Sheriff Tanner has some additional information.
Yes, sir. And I don't expect you to be aware of this, maybe even the commissioners, but we have a current contract with NCIC Inmate Communications. They furnish, we go through them for, they utilize phone communication in the jail. Also, we have a video visitation set up that runs through them. We also, they provide iPads in the facility in case an inmate wants to text someone at home or whatever. And then we opted into that contract in 2026 and updated our contract in 26. We were made aware by the company that the FCC, and you may have seen or heard this, had changed some of these. They felt like there was gouging in other counties, and there could have been potentially, but not, not here. And as a result, the FCC took up this matter and has set the rate what these contractors can charge per minute for these phone calls or per text or whatever the case may be. I was advised when this rate change came along that because we opted into a new contract in 2026 or 25, that we would be grandfathered and we would have until April of 27 before those rates changed. He called me just a few minutes ago during lunch and said that was not correct. That actually, in fact, the rates changed effective April of 2026. So we are not in compliance with FCC regulations. And my clear, concise comment to him was, you get us in compliance right now, because we're not going to be out of compliance. He said there are sheriffs in other counties that are already being contacted by media outlets and asking the question why they're continuing to charge a rate above FCC compliance. I said, get us into compliance right now. He's already sent me the letter and I've already signed it and sent it back to him. My question was, do I sign it or does the county judge sign it? Because in our county, the county judge usually is the person that's signing the contract.
Mm-hmm.
But he professed to me that it's not a contract. It was just a amendment to, so I've signed it. I hope that is, sufficient. It simply asks for the name, your title, and the date it was signed. So I signed it in reference to that. I'm going to send it back.
Thank you for bringing that to the court's attention, because obviously that's important to me. That is an amendment to a contract that requires Commissioners Court approval for you to sign on behalf of the county. Due to the exigent circumstances,
And I'm happy for y'all to look at this. So it's not something that I'm just professing to you. And basically all it's doing is, for an example, saying that now the rates will be, the base rate's 11 cents. The total per minute rate is 13 cents.
Mm-hmm.
The text messaging is 25 cents. Pictures are 35 cents. It's just telling you what the FCC has said. For you to be in compliance, this is the rate that they will accept.
Well, my concern is this business being conducted in a properly called meeting for that purpose. And I don't know what kind of workaround we're allowed for exigent circumstances, because this does need to be taken care of right now. So what I would like to do is go ahead and have a vote on it to get it at least approved, and then look into whether we need to call a separate meeting to make sure it's done the right way, because it's two competing things, doing it right procedurally, but also getting it done right now, because we don't want to be out of compliance.
Absolutely. And the question I ask him is, again, is this something that the sheriff signs or is this something the county judge signs? And he said, well, that depends on your policy. I'm not sure that we have a policy,
State policy.
but he said sheriffs are signing it. That doesn't necessarily mean that just because somebody's doing something, it's right.
Right.
So I'm just bringing it to your attention, and whatever we need to do.
Were you authorized to sign the initial contract, do you recall? Or was that the commissioner?
We'd have to pull the contract to see.
More than likely it was the judge.
But I would think it was the county judge.
I'm happy to sign it.
And I'd be more than happy to, if you want to sign it and send it to them as well, I can furnish you.
I'll sign whichever, if you've got the copy of the one you signed,
I do.
then I'll sign it.
Okay.
But I want to at least put it to a vote, even though it's maybe improper at this point, but I will look into whether we need to call a special meeting to make sure it's done right.
And it may be better if I have them print a copy that is, that requires signature, and they will have had mine, and then you fill out your credentials and send them a secondary one, so either way we're covered.
Okay. Yeah, that
I'm
sounds
perfectly
good.
good with doing that.
All right. I mean, commissioners chime in if you know something I don't know about a situation like this that needs to be dealt with right now.
It was an exigent circumstance. It required attention immediately.
I think he's probably good for now if he signed it. We can put it on the agenda for the next meeting.
That's what I was thinking.
And then I would sign it.
Yes.
Are you okay with that, Sheriff? Yeah,
If we're having budget session Monday, we'll call it
Monday,
Huh?
yeah, it'll be next Monday's for the regular commissioner court.
and have it on the agenda with the
We can
budget
get it.
session.
Okay. Then let's do that, Sheriff.
Okay.
We'll call a meeting, but if you wouldn't mind going and sending yours and assuming we approve it Monday, to get my signature in.
Can do.
I'm going to go ahead and forward you what they sent, which is a blank form, and all it'll require for you to do is just print it out and we'll send it to your email.
Mhm.
Assuming you have a county email now.
I do.
And,
It's a C car hand.
and then we can converse between now and then
Okay.
if needed.
All right.
Here, we have, the Rogers Clinic, Kim Rogers Clinic's here already, Judge. I don't know if we want
Well, then,
to table
let's,
our stuff until afterwards or.
yeah,
get them going.
I think that would be more efficient. I don't want them to have to wait.
Yes, sir.
Okay.
Marty, go ahead. The floor is yours.
May I step up closer? I don't see.
Absolutely. You're welcome to use the podium, sit in the chair up front, or
You're gonna speak. Well, first of all, good evening, gentlemen. How are you today?
Goodness, are you?
Welcome to the group here. I don't know what I call them sometimes, but how do you good sometimes bad? Hey, Debbie, how are you? Good. That's all right, don't get up. Eddie, good to
Thank
see
you,
you.
Marty.
Nice to meet you. Good. As you know, we're here because of the health of the community. Just to bring you a quick update, Mr. Carhan, excuse me, Mr. And I want to repeat some things you've heard.
Yes, ma'am. I'm sitting here quiet.
Okay. Navarro County is one of the worst health cities, counties in the whole nation. Our score out of 100 is 34 as far as health goes. And over half of our population have barriers to care. 37,000 out of the 57 or 55,000, whose numbers you're looking at, residents have no health insurance. They're underinsured, they're on Medicaid, or they're on. So our clinic was designed by Dr. Kenny Rogers with the federal government in mind to create a FQHC clinic, which is going to help take care of that gap. We'll be receiving federal funds to do that. We have not done that yet because we're a lookalike. It's kind of like having a driver's permit. So that kind of brings you up to date, Judge. Just wanted you to hear some of the background that we've been dealing with. Did you get all that?
no, I
I
didn't.
think you did. Okay, well, we're in a bad state, critical state as far as healthcare goes. And so our clinic is designed to help fill that gap. We have a sliding fee scale. We have lots of programs that help people who have no insurance, which over half the population does not have insurance. They're either uninsured or on Medicaid. So our scores are bad. We have like 44% obesity in our community and about 45% diabetic. So we, with the county, would like to work together to help that be better. And one of the things that the county has in their obligations is to, with the state, provide for the indigent care people in the county. And we would like to propose some changes to that program. In the past, the minimum the state has required the county commissioners to do is to provide 21% below poverty level for the indigent care. And there are a lot of requirements they have to meet. That depends on if they own a house or a car or a phone and how much they make. And for a family of 4, they can only make $575 a month, which or have that many assets, which is almost impossible. So we're asking the county today to consider raising that to 50%, which means that a family of 4 could earn annually $6,500, which is still very low and very hard for a family of 4 to live on. But we're hoping that it will give them some additional opportunities to gain some health care. At present, the county commissioners do not allow for vision, mental health, or dental for the indigent care patients. And we think those are very important. And we can do those at our clinic all in one place at one time. And so that's what we're asking first. And the reason being is because it helps the whole community, not just the individual patient, because, you know, health spreads to us all. We've seen that through COVID, how it can go through a community and devastate things and people. So what we're asking also is that we feel the best place for the indigent care program is for the people who are being interviewed to have access to all the programs we have available at one time. At present, we have sliding fee scale based on their income, the number in the household. We also have self-pay. We take insurance. We're grateful. We're just now completing insurance for our 3,000 veterans, TRICARE, that live in the county. They will no longer have to drive an hour and a half to Dallas or to Waco or someplace where there is a veterans facility. They can have care here. So we're pretty proud about that. And we're also feeling that based on those guidelines that a full-time and a part-time employee, which I know you have now, is really not good usage of taxpayer dollars. Other FQHCs and other indigent care programs don't warrant a full-time person until the number of patient reaches about 150 to 200. Right now, we have, last I looked, about 55 indigent care patients. And even though if we increase that, giving more opportunity for 50% below poverty level, I don't think it's going to go that high because it's still pretty low rate. So if they come back to the clinic and they walk in one door, one screening, one place, we can interview them for all their programs at once. If they don't qualify for indigent, they can qualify maybe for sliding fee scale or for primary care. There's a state program for the breast and cervical cancer program. If they're a lady needing women's wellness help, maybe perhaps we could get them on Medicaid or Medicare, what they can say. But it is not efficient use of your dollars or their time or your time spent in employment to have somebody jumping from office to office to figure out where the best place is for this patient. When the patient comes and they're sick, they've lost their job, they don't have insurance, they don't want to know what kind of program do you have. They want to know, I need health care now. So that's our job. Our job is to find the best health care program for all the residents in the county. I'm pleased to introduce Ben Henson, a retired Marine who lives here in the county, and also Norma Finnan. They are both board members and patients of the county. One of the checklists on the county FQHC program, so they keep us transparent, is 51% of our board have to be patients. So we are very transparent in what we do. The government is on top of us all the time. We get lots and lots of reports, which you will also have access to and quality to see and ask questions about. And another issue that's going to come up is our co-applicant agreement. And that was when we joined with you and said you would work with us to help present this program. But today, I know you're dealing with budget. And so I want to talk to you mainly about the best use of those dollars for the indigent care program. Right now in the indigent care program, 30 cents of every dollar you pay goes to salary and benefits. And that's, that to me is just not efficient use of, based on what other indigent care programs are doing, is not efficient use of your money or my tax dollars. 10 cents go to physician care, 10 cents go to prescriptions, 22 cents are inpatient care at the hospital, 18 cents is outpatient care in the hospital. 5 cents are labs and x-rays, and 5 cents are operations, software, supplies, and training. So right now, I know your budget's about 551,000. About 200,000 of that goes to benefits and salary and supplies, overhead, computers, things that we can absorb in our clinic at one time, one place, and help the patients do more. I don't think that there is another organization in the state, I've researched it completely and fully for indigent, that it doesn't see this as such a great need. This is how it needs to be done. What questions do you have?
Are you asking that y'all be the sole provider for indigent healthcare in the county and not let the patient have freedom of choice?
That's always been the way the process works. They have a contract with a physician or the hospital, which we did for years. If you remember, the hospital there, you got 500,000 and they matched it. That program no longer exists, and they went to the thing. But our clinic is different in that we have great results for Dallas, for Houston, for wherever, for our patients. Just recently, Baylor, Scott, and White and 25 hospital units decided not to take Medicaid Advantage people. And that's a huge problem for those people who need to go to a specialist and see somebody for something special, whether it's heart or spine or whatever. But we have, because of our situation of an FQHC, have a great responsible referral system with Parkland, with UT Southwestern. They're the closest ones that we work with, and they've been very generous in giving our uninsured patients a discount. So that's key for us to do that.
And how many employees do you have down there right now?
We have 14.
Can you remember offhand what their positions are?
Oh, sure.
Okay.
We have a clinical director who's also a practicing nurse practitioner, Jan Meredith. We have another full-time nurse practitioner seeing patients, Lori Bissick. We have one part-time nurse practitioner who's dedicated just once a week to women's health. She's there just to do things for women, and that's Annabelle Cook. We have a LVN, Gabby Sanchez, and we have 2 medical assistants. We have a part-time lab person, and we have a care coordinator, which is really different. Other clinics and doctors' hospitals don't really have a care coordinator. Once you're there and you're referred to somebody else, you don't have a lot of follow-up with your basic primary care who sent you there. But because we're an FQHC, we're required to have a care coordinator who follows the patient all the way where they go back home to see how they're doing. We also provide in our clinic a community closet. We can provide hospital beds free of charge, wheelchairs, walkers, anything they might need other than food, hygiene items, toilet paper, soap, conditioner, things that they need that they just can't afford. There's a lot of poor people that you all know are in McLaren County that need that situation. So we're unique to that we have that there for them.
And what about the other 6?
Oh, I'm sorry. Got sidetracked in. We have an office manager, Lydia. She deals with credentialing and billing. We have a billing specialist, Mitchell. It's a funny last name. I won't say it. We have a person up front who checks people in, Juana. And then we have also checking people in, Maria. And then we have a checkout person who is Jennifer. We have a comptroller, Maria Lemus, and we have myself. The 2 up front are the ones, it takes time to interview a person if they're coming in to find out what program's the best for them. Indigent Care has a whole list of qualifications and things they have to go through, as well as the self-pay, as well as the sliding fee scale. So the patient has to provide driver's license, they have to provide employee statement, banks, check stub, they have to provide address verification. So it takes time with each patient. We're still kind of a new clinic. We only started about 2 years ago, 2.5 years ago. And so we are seeing about 3 patients, new patients every day. And that takes 3 hours just to get their medical history, to screen them for the best program, to get them where they need to be. So we're really doing a lot. I'm proud to say that we've been working with Jake Elsley and his Congressional Discretionary Fund. He has put in for us for 2027 a mobile unit that we're excited, hope that that will go through. It's passed out of committee. It's going next to the house, and that we can go out into the county, take the medicine to the patients in the county, not that they have to come to the clinic. We can go to schools, we can go to churches, we can go to civic groups, we can go to community centers, and we'll have a complete medical unit that we can take and see people there. So that'll be in 2027. They've given us strong hope that the cost of our numbers being so low for healthcare in Navarro County, that we can get that done. And we're really excited about that. Other things that we're doing there, we're continuing, to press forward for the FQHC status, which means we'll get a lump sum every year from them to provide care. It ranges based on how big our clinic is, anywhere from 350,000 to 650,000. But the FQHC clinic was never established to be self-sustaining. It is nonprofit. It's always meant to work with the community to provide the care for people in the community. So they will always be there for us, but they are not going to give us enough money to be self-sustaining, because the indigent need more usually than we have to give. And the 37,000 that we're dealing with, they're uninsured, they have no insurance, are really hurting. So that's what we're all about. That's what we do. Did I answer all your questions?
Yes, ma'am. Thank you.
Okay. Did I give you 14? We have one part-time lady who comes in.
Yes, you do.
Okay.
How many patients do you think you see a month?
A month?
Uh-huh.
Yeah, we see about 19 a day. Can you do the math? Per provider. But the one provider doesn't see that many per day. One that's there one day a week, she probably sees about 7. So we're seeing about 19 per provider per day.
Okay.
And 3 of those, as I say, are new, because we do a lot of time in outreach. We can hand out a pamphlet and say, this is what you need to do, this is what you need to eat, this is how you need to be. But being there in person, teaching one-on-one with the community is what we've learned our community needs. They
But
need help.
out of those 19 though, a day, not all of those are indigent.
No.
Are in the indigent program.
No, they're not. I'm sorry, I didn't bring that pressure, but I'll be glad.
That's okay.
We get a report every Monday, so I can get you that. So that's how we've worked the indigent in the past. They've gone to the hospital's taken care of. So like I said, that would, the 551,000 that you have budgeted, I think you had about 800,000 in 2025 budgeted, and you had about 550,000 budgeted for 2026. But we will assume all responsibility. We will take all the billing, all the credentialing, all the payment, and use that money, because that gives us an extra close to $200,000 to give people, to the patient. And it's just better use and makes better sense with the funds. The other thing you've done in the past is graciously you've donated a lump sum to us to operate and to work. And one of the things we have really been missing, we get $1,000 a month from you now, which we're always grateful for anything, but it used to be about 70. And we are asking that perhaps you would reconsider giving us that $70,000 or $75,000 a year, because we need to educate the community and the county about diabetes and obesity. It's hurting us. It's hurting us all over our county. Diseases that the people have. We would like to maybe review this in 6 months, if you agree, and to be sure it's working for us and for you, and that we're not, hurting either side. We feel like the indigent care fund should be the last resort we should use for money. That if they're eligible for any of the screening programs we have, like sliding fee, or like self-pay, or Medicaid, or Medicare, those are the programs that we should go to first for them. And that indigent care dollars should be the last resort. So we're very conscious of it. We take very much pride in doing what's best for the patient and what we know is best for the community.
So as I understand it, what you were saying there kind of at the beginning, you want us to consider adjusting the threshold for availability for indigent health services.
From 21% to 50% below poverty level.
Mm-hmm.
And that means a family of 4 could make up to $16,500 a year. And that has to include their assets. So you can see, even right now, a part-time person make person working part-time, making minimum wage, doesn't qualify for indigent care. They make too much.
Right.
So we feel like there's a greater need and we need to expand that need.
So with the 19 people a day that you see, that there's gonna be a portion at least that are gonna be self-pay or insured.
Yes,
To where, you know, the clinic is generating some income from
Yes.
seeing those.
we
folks.
take private insurance, we take Medicare, Medicaid, self-pay, sliding fee, primary care, Title V, whatever, we take it all.
Mhm.
And we have to figure out what's the best for the patient and for their needs. And the 19 is really per provider, so that we have 2 providers. So we're seeing about, 38 patients in the clinic.
What do you mean by provider exactly?
A nurse practitioner or doctor
Gotcha, okay.
that sees the patient. Dr. Dale Campbell and Dr. Joseph Sato oversee all of our clinic as far as the medical end of it. They overview the charts and work with the medical staff. So actually in the staff, if you come in to see a provider, you'll see a nurse practitioner. At this point, we hope to be able someday to have our own doctor, but right now, this is the best situation we can afford.
Gotcha.
So, I know, Judge, you're not familiar with the formal agreement we had with you about the co-applicant, being a co-applicant for an FQHC clinic. So we can save that for another day,
Okay.
another time. But just to let you know, we're very involved and we want to do very much with the county. Oh, you challenged me when we were here one time that you said you would do what the people want. So we went to the people and, and I went to churches and I went to schools and I went to, community groups and civic groups. And I asked, and I simply told the facts, our number's 34 out of 100. Mr. Brewer looked at some of these and had said, well, some of them didn't sign them. And I'll tell you why. Some of them felt like they might be retaliated against if they did. So, but I want you I brought these for you all. Okay, you can look through. We also sent out, a petition to some of the churches that didn't want to do cards. I have a petition. So, you also challenged me to do a fundraiser. We checked into that, to put on something like the Ducks Unlimited, which is what you suggested, would cost us quite a bit of capital up front, which we just don't have. To have dinner, to have liquor, to have entertainment, to have a place, to have auctions. We don't have that kind of manpower, and we just don't have that. So what we did, we sent out a mailer asking for donations, and we have received back, that just went out in July, we have received back about 15,000 in local donations. So I want you to know, I took to heart what you tell me to do. And, the people I think need to, vote, and they did vote for health care. So you can read comments, and these are signatures that they also did. So I'll leave those with you today. Okay. And if you have any other requests, I would like to take care of them. Okay, Judge, did I give you a lot of good information?
I think so. So as far as the way the current system is, what's the interplay between your clinic and our health department?
The health department does not treat or see patients for our diseases. They do immunizations, they do tests. We do have a group that comes down from Dallas Prism that sees about 8 or 10 HIV patients there, but they're not seen by the health department staff. They're seen by the prison staff. And I'm not saying Prism, it's Prism, PRISM,
Okay.
and they are an FQHC. So they do the HIV patients. So the health department is charged with educating the public. They also go to schools like we do, or to health fairs like we do. They're also charged with keeping track of sanitation, restaurant sanitation reviews. They have an outside company, I think, that goes to, and they test their kitchens and report back to the health department. The health department turns that back into the city, I believe, as far as, I'm talking about sanitation. When if you close somebody down because the kitchen's bad.
Yeah.
Okay.
Gotcha.
So they do not see patients to treat them except for a shot or a test. We do refer them to do, a TB test there. They do tuberculosis test there. They do rabies test there. But I think maybe in the last couple of years, we've only had maybe 1 or 2 rabies and maybe 1 or 2 tuberculosis patients that they have taken the test there. We don't offer the testing. So we see the patient, we treat the patient, we follow up the patient, we provide them with what they need. As I said, with equipment, hygiene items, and we follow them. We follow them all through their care. Follow for calls and notes and those kind of things. So our board even writes notes back to the patients too. And equipment. So we're doing our best, and I hope you realize that.
Well, I never doubted it. How much did y'all ask from the city?
We asked, the 75,000, the same that you have given us as a donation.
Yes, the city for 75,000. Thank you.
Mr. Moore, do you have any questions for me?
No, no.
No.
And what is, for the FQHC that's still pending,
Yes.
and that's a big piece of this whole puzzle, isn't it? Because that's additional federal funding that would make most of this make sense. Is that correct?
That's correct,
Okay.
yes. It's federally qualified housing. And when Trump took office and Mr. Kennedy took over as the head of HRSA and Human Health Science area, they had a lot of questions because they felt Medicaid was being abused. I'm sure you've seen all the news, California.
Right.
So, and so things slowed. But because we're in such a rural area and it has such detrimental numbers, we're at the top of the list when they reopen that. And we hear from our Congressman, Jay Gelsi, and from John Cornyn, who's still in office, that we're top of the list. They both have written letters for us to HRSA. We talk to HRSA weekly, if not monthly, daily, sometimes, just keeping up with the things that they want and what we can do more. We have a checklist of things that are very specific that we have to do for them. One is the 51% have to be patients of the clinic. We have to offer certain programs. We have to fill out certain reports, cost reports. It's a huge paper load that other clinics don't have. You go in and see your doctor, you give your insurance card, you verify your information, you sit down. Whereas we're interviewing you for every program that we have every time to be sure there's not a better program we can move you to. They're also asking us for cost reports, outside audit reports, things that a regular doctor's office would never have to be considered. Uniform data reports, electronic handbooks. It's a huge paper load.
Yeah.
So that's why we have 3 people up front that are doing all that interviewing and getting all those reports.
When you're doing a qualification check, I guess the application process, you're looking at every program, not just indigent health, right? On the intake.
Right.
And so what kind of, do you have a software system or are you relying on the person's, signing, said, this is what I make? I mean,
They have to provide a W-2 or paycheck stub. There's specific things they have to give us. They can't just say, this is
Right.
what I'm at.
so there is a way that you're using to check that.
Yes.
Okay.
In fact, we follow up, we call employers, we verify where they live.
But like the situation where, I assume if you're, I guess qualified, you probably don't have a W-2. I mean, or is it?
Right. You might have a paycheck stub though. Yeah.
Okay.
Normally, if they work even part-time, they have some sort of paycheck stub. Otherwise, they're strictly indigent. There's that $575 a
Right.
month for a family of 4 is not going to go very far.
Right.
So that's why we're asking you to consider giving us a little more leeway there, and also the mental. If you're indigent, you above all people need some mental health guidance and dental and vision. That's just a given.
Sure. I mean, the question was just because, whatever the qualification numbers are, it's just verification to ensure that we don't have people getting in that shouldn't be. That was what the question was
Right,
about.
absolutely. It's very strict guidance. And our staff is trained. There are only certain people that can enter the process. I'm not one of them. They certainly, they're trained and all
Sure.
that. So, what do you do next? You think about this, you talk about this, how does this work?
Well,
We haven't got all our numbers in yet. When's that, when we're looking at that?
Soon.
And
Yeah.
This week, next
Yeah,
week?
probably this week, if not middle of next week.
so we're hearing requests at this point. We're not really getting into, it's the like to haves, and then once we
Right.
know what we're working with,
do you need something in writing?
Uh,
Do you need me to write this down in something that?
I think something in writing would be helpful.
Okay,
I mean, to know exactly what the request is,
okay.
because for you, since you're not an entity of the government, you're requesting essentially a contract. Is that,
Yes, we did have a contract with you for indigent care, and the commissioners unvoted it. They decided to not do it, so that was kind of hard on us, but we certainly would like to have something in writing.
I mean,
yeah, what, if you
I mean,
have some,
what I heard today from Ms. Marty was that she wants to take over the entire indigent care. I would think that's an extensive contract that needs to be in place, because
yeah,
that is a big deal for risk and liability amongst the gentlemen that are sitting at the table. So I'm not a lawyer, but if one was going to say, I'm going to take over this entire program and represent you and almost indemnify you in county
mhm.
of any risk and liability, that's what that sounded like to me. I don't want to put words in her
Well-
mouth, and I don't want to put words
Well,
in
yeah, that
his
was
mouth.
unclear. Is that
We
what
do
you're
have a
proposing?
contract you could pull up, one we did have with you that was
Nowhere
nullified.
nowhere near what you're articulating.
But you're proposing to replace what we have in place right now, with our
To
indigent,
better
our
utilize
health
our
department.
dollars, yes.
Okay,
No, it's not with the health department. No,
or,
the indigent care is a separate program.
Okay.
It's not related with the health department at all.
From what we heard this morning, Judge, the
right, okay,
department this
I
morning.
misspoke.
That's
Yeah,
okay. It's easy to confuse everybody, but it is a separate thing. And the health department does different responsibilities
sure.
than we do, because we're dealing with the public
Okay.
and the patients. Okay, well, I will do that, and get it to you. Would you mind pulling the contract that we had just to read over it and kind of see what it'd be basically that same type thing.
Okay,
Yeah, it's in the file.
I think you would need to reach out to Terry Jacobson, Judge.
Yeah.
He has,
But
he
Terry
has a
would look
copy of
over
it.
it.
Yeah, he's got.
Well, this has
copy.
already been discussed with your attorney and Terry from this.
But yeah, we can look at it. We can get it to Terry afterwards.
okay.
Okay.
All right.
Okay, did I miss anything? My board members and my patients.
Thank you.
Thanks.
Thank
Thank you.
Could we be dismissed?
Absolutely.
Thank you.
No problem. Okay, moving on, we've got Lori Stovall.
Yeah, they are.
Hey, Josh, did you see if Lori's out there?
Judge, I didn't even understand. It's just, that's what that's all been about.
No, I mean, I'm not privy to everything else, so there's no
I don't think
problem
the
there.
She
original
knew that.
contract was, I don't think the original contract was a turnkey
No.
indemnification.
Well, I don't think it's appropriate to discuss something that's got potential litigation stuff right now
Yeah.
without consulting the attorney on the,
You might want to sit down with Terry Jackson. We've had several meetings.
I can have him come after this meeting, so, or after,
yeah, we'll find a time to,
I'll have him come in. We're shooting at about 4:30-ish.
but as long as the commissioners are properly briefed. I mean, I want to be briefed as well, but there's only a certain amount that I'm going to be able to take in and.
No, it's pretty strict. You'll catch it quick.
Just let me
Hey, Lori.
Lori Stovall.
Yeah.
Ms. Lord, I've got just a small, I got your budget. I'll pull it up on a presentation, but go ahead and keep talking and we'll be ready to go. I just kind of, in front of them is kind of that, but in a little bit of PowerPoint presentation.
Kind of waiting on Cecily, but she tied up the 4-H today was our entry date. And Kim didn't call me till today about budget, so she's tied up with 4-H families right now. So I just wanted to go over the request for this year. because the request, we had some requests last year, and we had the change between Andrew being here and being the office coordinator, and then me. And when he left, I thought everything had been taken care of, but our budget was cut last year in a couple of areas. And one of them looked like it might have just been a typo, and I think that was in office supplies, and I've sent emails about it, but nothing was ever done. So this year, so we didn't get any increases last year, and we got a budget cut in office supplies. So this year, in office supplies, we're asking for an additional 500 to be added. I think we were cut almost 1,000 last year, but I'd have to look at the numbers to tell. It was like and it may have just been 500, but the difference was between a 3 and a 5, and that's why I thought maybe it was a typo. But and then in demonstration supplies, we do have a full-time program assistant now, and she goes out and does all of our curriculum enrichment with the aid-to-chick and different things that need demonstration supplies. And the state was cut. We did have a lot of cuts with the state last year with the big beautiful bill. It cut a lot of our SNAP Ed funding, and so some of the programming funding that I used to receive from the state is no longer available, and that was about close to $1,000 that got cut from programs that I go out and teach. And so we've asked to add $1,000 to the demonstration supplies. And then travel, conference, and training. That's our travel outside of the county for required trainings and things that we have to go to. And we've asked for an additional 3,000 to be added to that because of gas going up and the mileage rate has gone up, but our budget hasn't gone up. And we thought we were going to have to travel around earlier that I had contacted Natalie about, but I think we worked that out where we're not going to need to move funding into travel for this year. And we are still without an ag agent, and so this travel reflects without the ag agent. So we
Yeah.
spent roughly 15,106.53, or have projected to spend that. And that's with the ag agent being in the office.
Yeah, that was my next question. There's a lot of areas on the budget, your budgeted funds for this year that weren't used this year. Is most of that due to the fact not having
Yes,
an
all,
ag agent?
in our travel
That
budget,
was-
the only, portion that has not been used is 1,893.47, but we still have, September, we still have the state fair, and, curriculum enrichment will start up, so Marley will need travel money, and I will need just a little bit more travel money. I have some district meetings and different things to go to, so I think the 1,800 will last us through this budget period, but it'll be close.
Have you heard anything about from anybody? Are they even close to finding an ag agent for us? or-
I know he's announced it at all of our meetings. They, really trying to push it through extension. I questioned him about maybe resetting it, like since it has been open a year, we could reset it in their system that would make it sort of push
Feel
out, kind of
fresher,
like they do
yeah.
with real estate. You can reset your sales and push it out again. And he said our system doesn't work that way. But if you have any ideas of any outlets that we could advertise, I have the link and we could push out.
We have interviewed and we did give an offer to someone and they did not accept it. So
And the
He has a
other,
research guy from A&M and he just didn't accept the offer,
he
so.
seemed like he would be really good. And then we had another young applicant who really hadn't had any experience.
Fresh out of college.
Yeah, he'd had 1 year of teaching and quit that job and didn't really have a big background in ag.
I guess all the farmers are just gonna farm till it's all gone.
And there's a
It was
lot
if I
of,
won the lottery, I'd just farm till it's all gone.
and it's a lot of like new women and men out of college, and that's kind of hard to pick through.
Mhm.
And so,
It was scary. And I'm not sure
Yeah,
exactly how that system works. Because it's all put in on the computer. If they just weed through and send some to Jay, or he could go in there and hand pick through all of that. But I will talk to him again about looking more thoroughly at the applicants and see if we can.
some are just like automatic replies from like LinkedIn and all of that, so it's like some of them are really bad.
oh, yeah.
And you have to have
I
like
can
a college
imagine.
degree, and so that's a difference.
We used to get more than 100 resumes and applications for teachers every year. There's a whole bunch of them. It didn't take long looking at them,
Yeah,
put them in the other pile.
and some have like no ag background at all, I'm like,
College degrees.
yes. And that's scary. You
They
know,
are
anything
scary.
like,
That
what's a
first
cow?
one's
You're
called
like,
BS, and we all know what that is. And the next one's MS, more of the
They at least
same.
need some BS.
Then the last one's piled higher and deeper.
Yeah,
Yeah, it really doesn't. I'm sorry, but a lot of times it depends on the individual. College degrees are well rated for the individual. Of course, they got it,
Well, and
but
that's,
they don't know. It's like a dog chasing a car. They don't know what to do with it after they got it, you know.
that was one of the problems with the guy that we offered the job. He had a lot of experience, but it was before his degree. And the way the system's set up with A&M, they were counting him as
like
a
a new
newbie,
agent.
you know, and a new, fresh out of college person, but he was probably in his 40s.
Mhm.
So, you know, he was well established
Labeled.
and
He was labeled.
And then you could tell the ones that like will just get in a foot in the door, and then like when you interview them, you could tell they just want a foot in the door so they can go to another avenue. So you're like have to,
Is training.
yeah.
Mm.
We don't want to leave ourselves high and dry hiring someone with good hopes and like, oh, here we
Yeah.
are again.
And, you know, my hopes would be to find someone that would want to really stay in Navarro County and, you know, build their home in Navarro County, get to know the community.
Maybe from the Bear County.
And so I would rather wait for that possible opportunity than just take one that's gonna stay a year and move on.
Well, we appreciate everything y'all do.
Thank you. Yeah, my grandson's in shooting sports.
Oh, yeah,
They stay busy.
My other son shows steers,
yes,
grandson. So,
it's a busy time. We're doing all entries today.
you know, I told everybody since I started 10 years ago, that back in the early 90s, me and my wife was the club managers for Denver Road.
Mhm.
And so back when they were little, my kids were little kids. We had one kid that was a secretary, and we asked him for the minutes of the last meeting, and he said there were 23 minutes in the last meeting.
That's how good work is.
But you know, they were that little that they did not.
You know, typically most kids that are involved in 4-H and FFA tend to be very successful throughout life.
Absolutely.
From what I've seen.
They
the
develop
kids that we've
work
run through
ethics.
Our county that I've worked with, you know, have all gone on and been successful and finished college and or found a career that was really good. Have a lot of responsibility.
Both my kids have college degrees, and neither one of them's doing what they went to school for.
We do give out a lot of scholarship money, so just think, you know, how many kids we give out. Just our county alone at the 4-H Foundation, we had over $60,000 this year. And that's between 3 or 4 kids, so. Just think, if you have any kids that want to join, we have great scholarships.
I think, didn't we get?
We got the one, we
We
were
had
the
District
only
8.
ones in the whole state that had a kid receive a $30,000 scholarship, and that's one of the highest ones for 4-H. And then a few years ago, we had one that got a full ride for 4 years. It's called a Terry. It was over $130,000 for one kid.
That kid,
Yeah, she's an angel. She still comes back and helps. She still works. Now she's a student worker at the extension office at the state. Mhm. And so she still calls us for references and can we help her, so we're trying.
Excellent.
well, thank y'all very much.
Yes, sir. Thank
Thank
you.
you.
That's all we need to do.
Yes.
All right, thank you.
Thank you, guys.
Hey, Charlie, before we jump over to Josh, can I ask Ms. Caldwell if there was any discrepancies in what we heard earlier?
Yes, so that FPL percentage cannot be changed. That is mandated by the states, that 50% that she's
That's what I
requesting.
was.
That is
I
a
knew that
state
the whole time
percentage
she
that
was-
cannot be changed. The only way it can be changed is if the indigent program is ran through a hospital and they are deemed a hospital district.
Okay.
But that
Well,
cannot.
is that, now is that does the state set those standards or the federal government set
The
those
state,
standards?
the state sets the
Okay.
standards, yes.
Same difference, but
That is. in
that would
her-
be like the school changing the requirements for kids to be on free and reduced lunch.
Right.
You know, we can't, you
You
can't
don't
do
have the
that.
authority.
We don't have the authority to change that.
We'll wait for you.
And then just my little time that I was in there, I just wanted to clarify some information. The dental and vision that she's requesting that they can do in-house, that is not done completely in-house. They
Sub it.
basically, they take all the information and then they basically, contracting is not the right word, but they send it out through a third-party system to be able to get the patients to have glasses, or they send them over to Gallup Dental, but they do not take care of the actual vision, dental, and mental health in-house.
In-house.
They are just providing the resource and resourcing it out to the patients. Yes. And I'm trying to think, oh, and then the phrase as far as FQHC, and they have a great relationship with Park and UT Health.
Mhm.
I do the same, and I'm not FQHC. I mean, it's just it is so different than a relationship that you would have with a local provider versus a hospital. It's not something in particular or fancy just because you're an FQHC lookalike or your FQHC facility to be able to, for them to take those patients.
Mhm.
Because I have patients right now that go and receive care at those facilities.
Can I ask something just as a constituent?
Yeah, absolutely. Sure.
When an indigent healthcare patient goes into the clinic, which I served for VP of that board for what, 3 years,
The Kent Rogers Clinic?
yes. Not all the time is that person, do they want to feel obligated to go to that clinic? At the end of the day, yes, they're providers, but they're not doctors. And Jan Manor is my provider. Love her to death, but she's not a doctor. Sometimes as an indigent healthcare patient, they need to see someone very qualified for their needs. It's not fair to any constituent indigent healthcare resident that lives in Navarro County for the county commissioners to say, you have to go to the Kent Rogers Clinic.
They should have freedom of choice.
They should have freedom of
Yes.
choice. I can't tell you to go grocery shopping at HEB or Walmart. You go where you want to go. And I feel like if I become indigent and I can't take care of myself, I want to go to a provider that I think will best take care of me. If that provider is willing to accept whatever the county's paying at that rate, then they should be allowed to go there. So I'm not saying to not give them any money, but if that, let the money follow the patient. If the patients in the county want to go there, then yeah, they'll get all the money. But if they don't, they can't be mad that they're not getting any money.
Not a monopoly.
So I feel like the money should follow the patient.
Thank you.
Yes, sir.
Okay, Josh, didn't mean to take up any of the time.
No,
Sorry.
you're good. Well, it's important.
At least we're 15 minutes ahead anyway.
Yeah.
So,
Or we're
That
gonna,
don't
we're
mean-
gonna squeeze it in. on
That
the
don't
back end.
mean you can go
Yeah.
for 45
Yeah.
minutes.
Hey, I'm fine to get out of here.
Hey, I thought about you the other day, I was watching Family Feud, and Zach Brown was on there. Did you see him?
That's a fellow.
He got the #1 answer right on every question. on that last part. they did.
195
We're more
points.
than
Nobody's
just a
ever
face.
done
Yeah, 195 points.
We're more than just good looking.
He never took his hat off.
Yeah, well, I don't. Let it hair. I did cut my hair yesterday for the,
You got a haircut.
yeah,
A haircut.
yeah.
A hair.
So Josh, what we just kind of been doing is, letting the departments lead, the elected officials talk about their budget. Kind of the theme, I'll call it for the last day and a half, is about people, investing in our people. The commissioners have been hearing a lot about it. I know you and your budget, you're addressing that, kind of head on with the new deputy clerk position that you requested. So
Yeah.
kind of everything else is kind of boilerplate. You can go from there, but I know that is kind of your key one. And so,
For sure, and I can lead off with that if you'd like. So I've been here going on 17 years. I've had one employee added in that time, and I think it's just, we've gotten to the point where we only have 2 people working on the felonies, and when one goes to lunch or one's on vacation, it's either me or Ben or even Rosella that goes and works on that, and Ann helps. She's our part-time. And I have even deputized her. She's worked part-time for me so long that she can even work cases when they come back from court, even though she's a part-time employee. She helps more than just the back scanning and trying to digitize things. That's her preliminary job. But what I would like to do is add another felony clerk there. And after talking with Sherry and Sandy a little bit, tried to model it similarly. So they have one more employee than I do. So I don't think she's asking for another employee. I don't know. But one of the things we had talked about was changing, because right now I have 6 deputies, 1 chief deputy and myself. And I would like to have a senior deputy clerk on the felony side to kind of run the 2 people there and the part-time person. And then I have Connie, who's my senior. She's on the civil and family. She's in charge of making sure all of our reports. We have 2 family, 2 civil, 2 felony, chief deputy and myself. And it's just with more judges coming in, on top of the judges we have, more cases. Obviously, the felonies take precedent over civil cases when it comes to jury trials and hearings for 6th Amendment issues and things like that. We're to the point where we just need some more help over there. And one of the reasons Sherry and I talked about that is because, for one, her and Sandy's office, I don't know if you're kind of in limbo here, but her and Sherry's office are on 2 different floors. So it's hard to manage that. Mine are in 3 different offices, 2 different offices. It's hard to always manage that. If you have someone there, they don't need to be babysitted by any means, but there's always things that come up that are more than just timesheets, and it's more administrative. And it just turns out that a few years ago, I met this lady that, well, first off, she looked real familiar. We were in Kerrville, got to visiting with her, and she is Whitney Hawk's sister. Now, a lot of y'all know Whitney Hawk, detective. She's now at the school district, but her sister has worked for the Johnson County District Clerk's Office since 2013, and she's a chief deputy right now. And she is even, I've told her what the deputy clerk pay is at $49,000. I've told her what the senior deputy clerk at $52,000. I don't know if I'll even get the position to hire, but she's wanting to move here to be closer to her sister and Philip. They have a little farmstead they're starting now, and she's wanting to get out of Johnson County and move down here. And as the sheriff knows, everyone knows, machine operators, T-close certified officers, a chief deputy from another county, those are the kind of employees you don't get all the time, that already have been in, first off, administration roles, but also worked for that long for an office in another county, and can bring a wealth of knowledge to you where you don't have to spend 2 years training them or more to do what you need. So that is somebody that I had lined up that would be a good asset to us. And then my math may have been a little off, but I just multiplied it 2%, asked for 2% raise for all employees. I don't know what you guys have in mind as far as if there's anything across the board or anything, but I'd be remiss if I didn't ask for the hardworking deputies that I have to get a little bump if at all possible. So that pretty much encompasses the personnel portion of it. Are there any questions on that? I can give you statistics, numbers, but it's the same as, with more, attorneys and staff in the DA's office, more arrests, those things create more work in my felony department. And that's outside of all of your civil and family cases that we're handling also. If you have any questions on the personnel portion of it, I'd be happy to visit about it. Okay, and moving on, I know that in the past, I think I'd raised my travel back up. It was cut a little bit last year. In the past few years, I've been on several different boards and committees where they paid for my hotel and fuel, where they don't now because I'm not on those boards anymore. I've shifted to other roles. And also they're offering, because we're having more, not only our financial reporting to the comptroller that we do every week, month, quarter, and year, we have our statistical reporting to the Office of Court Administration, which has received a very robust set of rules that we're having to gather more data points than we ever have on what judges are doing. I think it's more or less to gauge a salary survey for the judges in the state of what they're doing. And again, I will tell you, our judges have no issue with that. They're here every day. Even when they're not, they're signing stuff on their computer. And again, with the advent of e-file and all the different softwares that we use, if Judge Lago Marcino can't sleep on a Saturday night, he can get on his computer and sign 50 documents. And then when we come in Monday morning, we've got a whole queue full of things that we have to work and get back out and service to all the attorneys and litigants. Again, that's another thing that would be helpful to have another person that has the administrative knowledge of how e-file works, Odyssey works. Another thing I know for sure, and it's not anything that I'm shirking by any means, but with all the new positions coming in, county judge, district attorney, county clerk, I know Sandy's in here and she's more than able to handle it. But the software portion of it falls pretty heavily on our office as far as, oh, and I got your username and password, by the way.
Thank you.
It would be nice to have someone else that's familiar with the software, that is familiar with running juries, that are familiar with the reports and which ones go to which entities, where it's not, again, all of our stuff is usually a month in advance, but with all of our reporting, it's weekly, monthly, quarterly, yearly, and that is for statistics, for financials, for, I have outside audits for our trust fund, which is anywhere from $7 to $12 million, for condemnation cases or car wreck cases where I put the money in the bank to collect interest for a certain amount of time and let me get it out. I do all of the financials just so I can keep it, at least for the trust fund, the daily taking in a case for $350 the staff handles, but and they know that better than I do. They work with Jane very closely in the auditor's office on getting the payment cards for the jury, and that'd be another thing that this lady could help with if she were to come on board, and that again would give us about the same number, or the exact same number of employees, I think, between the county and district clerk, and I can delineate their jobs. They are pretty well cross-trained, I guess. Most of them can do almost anything, but there's so many ins and outs when it comes to, like if the judge wants someone to come back because they skipped jury duty, you can do a writ of attachment, a capias, a bench warrant. I mean, there's a lot of different ways to accomplish one thing. And then certain instances, there's only one way to accomplish one thing. And it's good to have people that have the knowledge that can help, where it's not, solely me, I guess. for one, but,
When you specialize like that, you streamline and get things done better, like NASCAR pit crew.
sure.
They've got one job and they do it well.
And that's why, like, for instance, when we have to pull someone over to the felony side to help, well, they already have a job on the other side that they'll have to catch back up on. And the child support is another one that Connie is my sole senior clerk now. She handles all the family law, child support, the, SDU, which is state dispersal unit. We have to do a formula that's like, 60% of that money the state pays, we get reimbursed back to the county. She does those reports to the STU where the child support, I can't remember how many millions it is now, but it's over $10-11 million a year that come through our office for just child support alone. And that number could be higher than that. That was 2 years ago. But every once in a while they come and give a little certificate of how much child support you ran through your office and with errors. We work closely with the sheriff's department, the DA's office on keeping our numbers above 90% for the different positions that are funded by those grants and the different programs that those offer based on your reporting numbers. So, and right now, I think talking to Casey and Clint, we were above 93-94% for all three offices. So we're where we need to be. But like I said, it would always be helpful to have someone else in there to do that. Office supplies, I know up until the paper I have, I mean, I just ordered $9,000 worth of folders. So that's going to dwindle. Some of that would be possibly for a desk. We still haven't moved at this point. I believe whenever you do something like that dedicated account, it has to be done before September. So y'all approved me for the records management money to move everything. So I haven't done that yet for the mere fact that Ally, I was waiting on her to find a place to put those expensive machines. So I'm gonna have to wait till next budget so I'll have to cancel that PO and get another one issued, most likely after September, because he can't get it all moved before the second week of September, which was when it would have to be due. So that being said, I will start that process again in October, but I would like to add a computer over there, which I could take out of office supplies. I didn't list it on my $500 up deal on the budget because I typically, based on our policy, you have to contact IT department. They order it and I just sign it and they take the money out of my budget. So I didn't know the price or what she would recommend. Most of my staff, we all have laptops. One of them uses laptops solely at their desk. And then we also have our desktop computers, which have quite a bit of memory, but as much as we download and have to e-file back to filers, it fills up with memory every so often. They have to delete that RAM and it keeps us from having to buy new computers. But we do have a maintenance system and a leasing program with those.
Sure.
So we don't worry if one goes down, we get a new one. But we also have our laptops where we can work remotely throughout the courthouse, whether we're in a jury, downstairs, upstairs, in here. And one of the other things, as far as the travel, there are a lot of I kind of skipped over that, but a lot of these new reports have been troublesome for the state as a whole, and especially clerks. A lot of the like our jury wheel was corrupted from the state, so it had bad addresses in it. So the state is having a big issue with their own software, and then they're wanting us to report things that we have no way to do it through. That being said, I've had Brenda and Rosella went to Palestine for 3 days. It was just a back and forth trip. They had a big DPS and CGIS reporting there where they bring someone from the state. There's a lot of these meetings that happen in Waco or Dallas, but it doesn't require them to stay the night, but you still have to have money to pay for their fuel. And I'm more than appreciative. They get a little antsy about asking, but if they're willing to go and learn, it's, otherwise I have to go and come back and teach them again when they can hear it firsthand, ask questions to other counties. It has been very helpful to all of us. So if that could be bumped back to the, I think it was 8,000, then I would be greatly appreciative for that because, Ben and I have shared a room before, and the girls have shared a room, but that also accounts for a little bit of that money, because if it's me and one of the female staff members, you automatically have to have 2 rooms, so that keeps it up a little bit. But anyway, that would allow us to do more learning.
Josh, can I just make
Yes.
a clarifying point? Sorry. Maybe have your help too, because I want to make sure we get it right. On this here, Nat, the 459, this is the last page, gentlemen. Did we already burden that contract because it's already, I mean, the build out of those new filing cabinets because the PO was already in place? Because it looks like it's right there.
It's not on this one. It's in his, special revenue fund.
Okay, it's going against that. That's right. It's going against that. So what was this? I can't remember.
That's for the software for the hosting it on the cloud, I believe.
That was a one-time fee that we had to push.
Well, that's
That
a
was-
yearly fee. It's split between myself, the judge, and the DA's office and the county clerk.
Okay. I don't know why.
And I couldn't tell you.
Well, that's not even credit. That's,
I mean, that's. the
we're
difference,
over 35,000 there.
yeah.
And the,
But that bottom left dot explains it.
Yeah, it's the computer maintenance spend.
Yeah.
we
So,
did check with Tiffany though, none of those are going up, so I didn't
no, I
raise
know,
it,
yeah.
but, which was shocking. They go up on everything else. But, we did not have anything there. There was something else I was,
Does each department do their own computer contracts?
No,
well, we used to, but we got to where we all shared the same things pretty much. Like, Sherry has a contract.
Where you
I
can't.
have a contract, the DA's office had a contract. But for the entire county, we host it on the same AWS server in the cloud, and we split that between each office. When I do jury summons, we get one bill, and either Ben or I will label DC, grand jury, CCL, county court, and we, even JPs, and we put how many summonses were sent from each office so they can break it down to each budget. They just preferred, rather than it all be in one budget, to spread it between the 4.
Yeah.
The judges and their staff, court reporter, court coordinator, bailiff, even the probation department has a view-only mode, so they can look at the cases from their office without coming over here. There are technically users under the district clerk's office. And then, of course, the county clerk has their own set of users and the DA's office has their own set. And did the jail ever get a view only of that? We could set that up for the jail as well. We just in this past year did it for, adult probation, and, it seems to be working well where they can view documents remotely.
Is that an additional expense?
And we still don't have, most counties, a lot of counties, I'm not gonna say most, a lot of counties have, their whole county is on the same software. So our number of users is still low enough that it's,
So
that it's,
it'd be in the same tier?
yes, it's not gonna raise our rates at any level.
Josh, I know Natalie just talked about the special funds. I know you have different funds where you actually collect money. One of the deputy constables was asking for an additional person. I think one of the questions the commissioners asked was there other ways that we could create revenue or offset revenue to offset that person, anything in your office? Because I know you have a little bit of flexibility in different things.
I do, and I bring it up every year, so if you've heard it before, which I know you have, I'm sorry. But, people in my office don't pay their court costs normally. I think if in a year I bring in $10,000, Sherry will bring in $110,000. So every time you get a birth certificate, death certificate, marriage license, you pay for it right there. There's no indigency. So she gets $20 off every one of those documents, where my cases will go 5, 6, 8 years. And then they go to prison for 20 years. Then nobody's paying that. And most of the time they're deemed indigent. But that being said, we do bring in some money from it. I mean, that's the sole source of our income is filing fees and whatever's put on judgment to go through, fines that go back to road and bridge and things like that. A lot of those, like I said, most of the records management we put together with my archive fund, and that's what I'm using for the other, but typically that would be used to restore old documents, scan them, bring them in, into a digital world. Now, there are set fees that are dedicated, like the, law library fund can be used only for law library, furniture, computers, books, or Westlaw, something like that for the law library. You can also partner with the city with that or any local municipality to have a combined law library. There is courthouse security. That is one of those fees that make up the $350. That's typically for bailiffs or their security guards. So that salary can be pulled there. There's a court reporter fee that goes to offset the court reporters' salaries, all of those. So within the fee schedule, there are specific case fees that go to make up that schedule. So out of the 350, you may have $20 here, 15 here, whatever, but those are dedicated to certain items. And so if there's somewhere that, you know, for instance, I can't imagine that if you have 3 bailiffs and 3 security guards, but if that courthouse security still has funds in it, that would be one you could use possibly for a constable because they serve as bailiff for the JP courts. That would, I
All
don't know.
those fees that you just talked about, are they state regulated or we have the ability?
They're state regulated. There's some that you can add, but
Yeah, because I
but
understand
you have to do
you
those.
just changed something, just approved to change some of your fees. Helped us out on Commissioner Court meeting or 2 ago, where some of your filing fees we were able to increase. So I didn't know if any of those were.
Well, we're maxed out on what we can because the, you know, the ease of access to the courts.
Yeah, yeah.
You don't want to get too cumbersome on those, so we can only charge up to $20 or whatever. But there are others that other counties have, like alternate dispute resolution or even, you know, the pretrial diversion programs or drug court, what they call it, or veterans court, things that we don't have, you can add on top of those. But the other fees are state regulated, and Sandy's been through it with me before where I think they finally got it where they want it. A couple of years ago, we had to change all of our fees, standardize them. $137 goes to the state, the rest goes to us. And it's broken down into those specific categories.
Any further questions?
And the last thing I'll say is I plan on starting back our, for those of you who've been here and seen it, we generally come down here in the basement. And I've had Limestone, Freestone, Leon, Hill, Anderson, Kaufman, Van Zandt, all the counties that are close around us within an hour, Hill County that have our software. We typically meet here because we're kind of in the middle. And we'll have the TV set up. We'll go through questions to treat it like it's a conference or a meeting. A lot of those county shared judges, like I think Freestone, Anderson, and Limestone have 3 judges that rotate around. So the more we can be uniform, as you know, Judge Black's from Freestone County, the more I can do things that they can do things like I do, makes it easier on the judge to just slide in and do their job without having to worry about, well, procedure, protocol, what do y'all do in this situation? We try to make it more uniform. And I'm going to wait till after January because I'm sure we also have DA's offices that come. I know Carrie will want to have people down here to help her, the staff that are up there now have a very good understanding of it. And so does Sherry's staff. But it allows us to all get together and ask questions like, well, we got a new county judge. How do we add him as a user? Or how do we get him to see sealed documents? And those are things that we work on as a group that doesn't cost anybody any money other than the gas to get to one location. We already have all the TVs and laptops and software and the things we need. We just try to work it out with each other because there's nobody else that does this job unless you call another county. So we try to make it work.
That sounds good. I like that.
And I'm happy to help. I know Sherry, Sandy is as well. I'll invite her to help me.
Thank you.
Anything further? Good.
Appreciate it.
Thanks, Josh.
Thank you, Josh. Yes, sir.
Does you want to keep going? You need a 5-minute break? We got,
we got-
planning and zoning that or standards of that?
Y'all, all right, taking 5 minutes? All right, let's take a quick 5.
Feel like.
We're in recess.
Kick that ball.